Hey, CB, I think we will start actually, yeah? Okay. Good evening, everyone. Welcome you all again for the next PLAB session.
Yes, sir.
Mainly focusing on part 2 of the PLAB exams. I am Dr. Manikandan Kadipel. I am one of the consultant surgeons in the NHS UK, and I have with me Dr. CB Raj and Dr. Anu Vasant today to lead the session. And today the important thing means the topic for today is very, very important, and this is one area which is considered as a weakness for most of the international graduates who come into UK and give their exams, which is the ethics component. So I will hand over the stage to Dr. CB and Anu. So they will initially give an overview about how these stations are, what are things you need to consider, how you take yourself through the session, and later we will do some practice sessions. Okay, like last week and the previous week, we want you guys to volunteer when we do this practice sessions, so that the session goes very interactive and informative. Okay, thank you very much, and over to CB.
So hi guys. Today is the sixth webinar of the PLAB webinar series, and today is a very important topic, ethics, and you might get about 3 or 4 stations from this, and this is not something we're very used to in an international medical graduate setting because we're not taught so much about it. And UK ethics plays a very important role in clinical practice and how you deal with patients, and it also forms a big part of good medical practice, which you would have come across a million times when you've read for PLAB 1 as well. So we are going to deal with scenarios where you should know what you're dealing with and how to go about certain scenarios, and how do you deal with patients in these scenarios, where you have ethical dilemmas about many things. So I will give it over to Anaga, to start the session. So yeah.
So, thank you for giving me this opportunity, first of all. So, hi everyone, my name is Dr. Anaga Vasant. I recently cleared the PLAB 2 exam, and I'm here to guide you through the ethic case scenarios. So, first of all, we need to understand that what exactly they are testing you for. So what they're testing you is that how safe doctor are you? How safe are you as a doctor? And for which, how well versed are you with the good medical practices as well? So ethics mainly deals with cases which are very sensitive and delicate, and you need to be extremely empathetic with patients here. And it also deals with the way you speak, the way you present, and basically your interpersonal skills, and how well versed or how much do you understand about the confidentiality as well. These are something that is completely different from our Indian scenarios, and which is why it majority of the time these cases have heavy marking scheme as well. And you need to just understand that this kind of case scenarios, they're not you don't need to rush them, because you don't have to manage your time here. Basically, you need to be very slow, have your own rhythm and your flow of consultation, because it can you go over to the next slide? What it actually includes is the breaking bad news, how you break down bad news or a bad diagnosis, which is not something that we usually come across, and where in place you need to tell them that this is something that is a completely safe space to talk about, and we will not be diverging this information to anyone else. But there are also scenarios where you need to understand that, give them the information that if at all the information you give us does any harm to yourself or to others, then we might need to breach the confidentiality as well. So, and we will be discussing about abuse and how to deal with patients who are refusing treatment as well. I hope I was clear with everyone. Is there anything that you need me to clarify?
Just to add on, yeah, so whatever these 4 important topics are very, very vital, yeah, and majority of the time when these scenarios comes in your exam, these stations and scenarios are designed in a way that you will feel very uncomfortable and you will do mistakes. Okay, this is how these stations are designed, and these are the stations which will make your results questionable. Okay, so understanding of every concept is very, very important, because the practice what you have been doing in any other country apart from UK is completely different from what we practice in the UK. Okay, so kindly listen to the topic, and I'll be available, and at the end we will have few scenarios which we will discuss. Thank you, Anu. You can go ahead.
Thank you, sir. So, coming to the first topic, that is BBN, which is nothing but the breaking bad news. So, like Sir said, like Sir, he mentioned it right now, these are scenarios that will make you uncomfortable. And sometimes the patient might not talk at all, and sometimes the patient might talk a lot. So, this is not a scenario where you need to manage time. You just need to have your own flow and how you would consult as a consultant. That is what they will be looking for. So a breaking bad news in case like you will be giving a scenario where you have to break a bad news to one of the bystander or the relative, and so you don't approach by first itself, explaining ki haan, this is what is the diagnosis. No, there is a pattern that you need to follow, which will benefit you in because we are not familiar with this. So we don't diverge in it first itself. First of all, what we need is a little bit of information we need to gather from them. So as to ask them like, how much can you just run me through what really happened? Why was your father admitted here? So that I can understand better, and I can answer your questions in a better way. So that is very important as a opening question, giving and asking them. So they might tell you, and that is how, because the question might not tell you what is the scenario completely. You need to gather the information briefly, just go with it, and then you ask them what the way I approach is recall risk factors. Because if in case the breaking bad news is about breaking a news about a cancer, so you need to understand, in order to answer their questions further, you need to understand what might have caused it, because they will obviously ask you saying that, oh doctor, why did this happen? I cannot believe this. So you need to understand that. So for that, you need to ask them a brief medical history, if they had any history of alcohol or smoking or any other risk factors as such. So yeah, and soon after you do it, you set a scenario, set an environment, ask them if in case that they're coming for a report. So you tell them, I have the report with me here, but I understand this is like you are anxious about the reports, but before we go into it, can we just have a quick chat, if you don't mind, and ask them, do you know what is your expectations about this consultation? Ask them ki, are you comfortable to discuss this with us right now, or do you need someone else to bring here, so that are you somebody who can handle a bad news as well? So you need to set an environment in such a way that they are also comfortable, and you give a warning shot in such a way that they know that it is something bad, but you're not giving it as a shock to them. So you have to say it, you have to say it ki, I'm afraid I don't have a good news with me today. Is it something that you're willing to talk about? Do you need someone else to talk about? That is how you need to approach it. You need to give it a warning shot, not by saying ki, I have a bad news, but you turn it around and say, I'm afraid I don't have a good news. So avoid negative terms. That is what I would ask you to do so as well. Give them an option, whether do you want to discuss it or not, because some people really can't handle it. And those are the things that will give you points for interpersonal skills, because you need to understand what do they want from you. What are they testing you for? Okay, so can we go on to the next slide, if you don't mind? Yeah, so coming to the whole scenario wherein you break down the news. So, like I mentioned before, you say that, I'm afraid I don't have good news. And is it something that you want to discuss? And, you after that, you don't usually talk. Give them the space to analyze it, give them the space to actually absorb the information. Ki, okay, this is not something good, because it's not a station where you need to talk a lot. It's about where they tell and you give a pause, I'm afraid that your reports have come here, and you have got diagnosed with multiple myeloma or something like a blood cancer. So you pause. You don't keep saying, this is the report, this is bad, this is bad. No, that is not how you approach. Because after you break a bad news, the patient will not have a mindset to understand anything. So you need to just play along with them. It's a dance. You have to play with them, and you give the warning shot. You slowly break down the words word by word, what exactly it is, and you tell them, I'm here to answer every question of yours, and you're not alone in this position, and we all are going to be there for you and I'm here to answer every question and then you further go on and proceed further, whatever question that they put. Acknowledge their emotions also, because you need to say like, if you don't validate their emotions, they might break down, they might get angry. How can this happen? They not everyone takes the news well. So you need to say that I can understand that you're really angry, or I can see that you are very upset, and anyone in this position might feel the same way. So you need to be extremely empathetic here. You need to offer them tissues if they start to cry. That is how you would approach if someone dear to you also reacts the same way, won't you? And like I mentioned before, avoid negative words as well. Is there anything else you would want me to clarify regarding this? I guess not. So I will proceed further.
So the next one is confidentiality. And so confidentiality is something very important in NHS. So you need to know that in an NHS situation and in a UK situation, you can only discuss patient details with only the patient, not the patient's attender, patient's son, patient's daughter, patient's husband. Unless they want you to divulge some information, you don't have any right to break confidentiality. Always make sure you respect the confidentiality of patient's bodily autonomy and patient's circumstances, patient's clinical diagnosis. So only in rare circumstances where you feel there is a need to divulge information other than the patient, you discuss that with your seniors, your consultants, your registrars, then you can divulge it to the patient's attender or someone else. See, for example, here, if there is a condition which the DVLA doesn't permit the patient to drive, for example, a TIA or a stroke or anything that causes a person to not allow them to drive, but when the patient comes for follow-up and the patient tells you that, no, I am still driving. So that is a scenario where you might break confidentiality and then inform the DVLA that there is something like that happening. So this is not something we should allow. So you can notify the DLA regarding the patient and the patient's condition so that they can revoke the license for a period of time before the patient can drive again. Again, another scenario where a patient comes in with an STD and you discuss with the patient to talk to their partner or partners about the diagnosis, because they might also have got infected with this. But then when they come for a repeat checkup and they feel that you understand that they have been informed to the partner, we have something called the partner notification program, where you gather information of all the partner or the partners of the patient and then divulge to them about a diagnosis like this, so that they will also know that they might have an STD or a sexually transmitted disease that they have. Now, confidentiality in adults is one thing, because in adult you have certain scenarios where you can breach confidence, or there are certain times where you feel the patient doesn't have mental capacity to decide for themselves, where you break confidentiality. But confidentiality is in children is a bit of a very gray area. So how we divide this is anyone below the age of 16 are children, and we have it in our mind that you should be able to understand if the child is able to understand what you said and is able to make a decision on their own, and they understand very clearly about what you're saying, weigh that information, retain it, and make a decision for themselves. If they can do all of this, then they're competent. And in that cases, you are not supposed to break confidentiality, ideally. So that is what we have, we call in the UK called Gillick competency. So ideally below the age of 16, you should assess the child's mental capacity to understand anything. It's a medical diagnosis, it's about sexual health, whatever it is. If the child is able to clearly understand and make a decision for themselves and have the mental capacity to decide for themselves, you are not supposed to divulge the child's clinical information or any personal information to even their parent. So you have to always remember, in children, in a clinical scenario, if the child is safe, if the child can make decisions on their own, if the child is not being abused, then they are mentally competent, and you cannot break confidentiality in all these cases. And that is very, very important. So if the child, again, like I said, if the child is 16 or below, you have to check the age of partner in case of safe sexual activity. So if the child comes and tells you that, I'm indulged in regular sexual activity, but my partner is a 16-year-old guy who was my classmate, then this is a scenario where it is two mutually consenting adults or two mutually consenting people, and that is okay. Because it is not abusive, it is not something non-consented. So this part is very confidential information. So even if their parents come and talk to you about it, you can't divulge any information, because the child understands what he or she is doing. But when you discuss to the child about their partner, and the child says, no, my partner is about 35 years old, or if the partner is my teacher, or if the partner is a neighbor who is very older than the child, then you should investigate it more, because that comes from a position of trust, position of power, where the child might not know the child is getting abused, but the child might be getting actually abused. So you should be very carefully analyzing the scenarios as to what is happening with the child. If the child has mental capacity, is this harming the child? And so you have to make the decision in these cases, to find out what is going on, what is the age difference, is it a consenting adult of the same age, or it's someone very older. So all of these comes in, and check the mental capacity. Again, like I said, advise the child to discuss this with the parents. Most of children might not discuss this with parents, and by vice versa, I mean, so a child comes to you, and there is a 15-year-old child who's having consenting sexual relationship with another 15-year-old, and you discuss with them and you give them contraceptives, and their parents come in and ask, so doctor, I've been coming to a GP clinic for about 15 years. I want to know about my child, what my child is doing. Is he or she having sexual relationship? I need to know about that. You should encourage the parents to have the discussion with the child, and you can't break confidentiality in these scenarios unless you feel that the child is having sexual relationship with someone who's older or is getting abused. In those scenarios, you can breach confidentiality and tell the parents something like this is going on. But before you come to the parents, there are 2-3 more statutory bodies, where you should inform before coming to this. So we'll come to that as well. So ultimately, the idea is you respect individual or child's decision and bodily autonomy if they have mental capacity, and you do not get to divulge any information to any other person for any other reason until it's in a written paper saying they are the lasting power of attorney, or they are the ones who are taking decisions for that patient's health. uh, until you see something like that, you're not supposed to divulge any of these information to anyone other than the patient. Now, where do you breach confidentiality? So if you feel the child does not have the mental capacity to understand consent, mostly children below the age of 13 might not have this idea of what they're doing. So make sure you keep that in your mind. If there's a big age difference, somewhere child is 13 and the adult who is having sexual activity with a child is about 25 or 28 or 35, there's a big age difference, and suspected foul play, bribery. If it might as well be someone the child is related to, and the child is being abused, but the child doesn't even know that the child is getting abused. So you should dwell more into it, about what is happening, who is doing this to you, what they are doing to you. And these are all very, very sensitive and delicate situations. So make sure you talk very politely, try to understand what is going on and what is really happening. And you might as well have scenarios where the child might come with the mother, and the mother might tell, no, my relative is not like that, he or she will not have done something like this, my child doesn't know what they are talking. So you should have in mind what is the environment, and you should make sure that the child is protected and the child is safe. That is your number one priority as a doctor. And if the child has a history of abusive relationships inside the family, and if it's a broken family and child has abusive relationships, and or if the scenario is where children are being used in trafficking or sex trafficking, and the child's life is a threat, in all these cases you have a right to breach confidentiality and inform people. So there is police, and there is other set of social services where you can inform and divulge information saying that, okay, this is happening, we are suspecting foul play and all of that. So in case of safe sexual activity, again, if the child has mental capacity, and ask the child to persuade her to inform her parents, in all these scenarios you can give contraception if the child has mental capacity. And if so, ask the child to inform about what is happening with them to the parents. And you can't divulge the information if the child has mental capacity. Only the child can discuss with the parents, and vice versa. And if the child is likely to continue sexual intercourse without contraception, and without contraception she would suffer mental or physical trauma, or it's in her best interest to get the contraception, all these cases you provide contraception. Okay. And what is the criteria you have for an abusive relationship? If the child is too young, 13 or below usually, and and is unable to give consent, in all these cases it might suggest an abusive relationship. And the age difference, if the child is not mature and there is a power difference, like known relative or someone who is abusing the child, so that is a power difference. Yes, Rohit, give it out.
Yeah, I understand. I had a doubt about the age difference. So, obviously, if it's like 10, 15 years gap, I understand that, okay, it's fine to break. But is there like a line where like you can decide, okay, this is too much, like between 15 and 19 years old?
Yeah,
knowing
that
that they're
I
not
say
classmates.
might be okay. About 15 to 19 and 15 to 20, that should be fine, I guess. But again, it all comes down to, if the child is below 16, it all comes down to, does the child have, you should try to find out, is the child mature enough? Does the child understand what is consent? And you should figure out if the child is getting abused or not. If all these are no, then it's fine. If
To add on, like what we need to understand is that there are different factors that come into play. Even if the age is okay, but then you need to understand first of all the mental capacity. So apart from that, you need to take. There are two patients here. One is the patient herself coming, and the other one is the partner who he or she is having a sexual relationship. So you need to take both their histories. And if the partner that she, first of all, not to assume the gender of the partner as well is very important, extremely important here. And in any cases, not just in ethical cases, but any cases. And the other thing is that how do I say it? um, the mental capacity, you need to ask them questions that, do you understand what will happen if you don't use a contraceptive? Do you understand that you might get pregnant with it? That is very important. And if the partner that she is having the sexual activity with, if the person is actually with a position of power like her teacher, that is completely no. So that is where there are multiple things that play into which need to be considered before you decide that this is not good. And if it's a child, then you will definitely involve the police. You will do the pregnancy test as well, even if you don't doubt, you're doubtful about whether she's pregnant or not. Because most of the time, if they are pregnant and the person that they're having sexual activity with, they might just push them to have come for consultation and ask for contraceptive as a method of abortion. So that is why, if it is a minor, you need to actually involve the social services, police, pregnancy test, and the child protection services as well. So there are multiple factors which you need to look into and then take a decision regarding this, not just one single thing. That is what I meant. Is that good enough for you to
Yeah, thank you.
yeah, okay.
So if it's non-consensual, and if a sexual partner is known to police or child protection agency, then these are all no-nos. And so again, like Anaka said, it's a myriad of things you need to consider before you decide if this is right or not. Age is just being one single factor in this. So once you determine, it is, let's say, a scenario where a mother and a daughter has come to your clinic, and the doctor tells you all of this, and the mother is with the doctor, and it probably turns out to be the mother's boyfriend or mother's brother. The mother might tell you that, no, my kid doesn't know what she's talking about, or my brother or my boyfriend wouldn't do something like this. You should make sure that you separate the mother and child. Make sure social services takes care of the child. Social services will kind of question the child entirely to know if the child is in a very safe environment before they even release the child. So the utmost priority for you in these cases is the child safe? Is the child going back to a safe environment, and does the child understand what's a safe environment, and are they going to continue being in a safe environment? So all of these are the very important things in these cases. Now, abuse as such, now coming out of sexual health, abuse is, you might get cases where
I'll explain it if you don't
yeah.
mind. Yeah, okay. So basically, abuse again, it's not that you need to rush through. You need to be extremely empathetic to them. Most of the cases, the abuse cases that they come, they will not tell you that they are being abused. They will, most of the time, majority of the time, they don't tell you. They might just keep quiet. They say that, they might have got burnt or they're injured for something else. Or there are cases where they just feel, they just complain saying that, I'm not having enough sleep. So you need to approach such cases by, in case of sleep, like you need to rule out the other factors of not having enough sleep. Like, is it because your environment is not comfortable? Is it because you have a OSA and you have difficulty snoring, or because of that? Or is it because of a narcolepsy? So there are different cases where you need to rule out them, approach them as a normal consultation, and then, like, you need to always have a differential diagnosis. Even in cases where you have to diagnose a case, where you need those are the cases where you need to manage time very well. But in those cases is where you need to always keep in mind that you need to have a set of differential diagnosis. And if you don't land up in a diagnosis, you will not you can always give it is most likely to be this diagnosis, or it could be this also. And even if you give a diplomatic answer, most of the time you can at least cover up a lot of things and you get points for that, instead of giving a wrong diagnosis where because they're not testing you whether you are a good consultant or not. They're just testing you how safe you are. Because in case you give a wrong diagnosis and you refer them to a wrong department, then it becomes an issue. So then you're not being a safe doctor. You need to understand that you're just an FY2 level, and that is all is required from you. If you don't know, then it's all right to accept that you don't know that case. So coming to, again, sorry for sidetracking, coming to, again, abuse cases, they most of the time you need to make them comfortable, telling them that it's all right to talk to me if is there anything troubling you. And these are cases which are extremely delicate, and they will not open up unless and until sometimes you offer them confidentiality. And you don't just throw confidentiality just like that as well. You just need to phrase it, reframe it many a times, like, this is a safe space to talk about, and anything that you give us information will stay between me and you. But in case if I find that the information that you give me is going to harm you or going to harm anyone else, then I might need to divulge the information. So in most of the cases, like rape cases, you need to give them that confidentiality, give them that space area, that it is a safe space to talk about. And only then they will be able to open up. Yes, doctor, I am not comfortable, thank you for making me comfortable. And only then they open up to you. Unless and until, there are cases where they keep quiet until the 6th minute of the time, and it's very hard to approach such cases. So you need to understand that you need to make them comfortable, don't rush them. And in these cases you need to listen to them. They will rant, they will vent, they will tell you a lot of cases, a case where other people might be also in a similar situation, like sex trafficking scenarios and all. So you need to offer them confidentiality, ask them, and you don't let these people go home back again. You ask them who hurt them, who attacked them. You explore that area, but keeping in mind, you ask them politely, are you comfortable to talk about this? Is it something that you are willing to talk about? If you're not, if you want me to, if you're comfortable with someone else, if you're a male doctor and the patient is female, it's always good to always say that if you're comfortable with a female doctor, I can very well involve them that too. And you might be fetching a very good marks for that as well. So making them comfortable is what they're testing you for, how safe you are as a doctor. And admitting them and investigating any kind of abuse, even if it is an elderly abuse, or the cases that we used to get in PLAB 1 itself, where the child has spiral fracture and a lot of bruises all over the body. You cannot directly tell or like we said in before as well, we cannot really tell them ki, this person is abusing you, but you can indirectly make them say like, do you think that this might be happening, instead of you directly telling them, because they might turn around and they might get angry instead. So you need to play with the words here, that which is very, very important, and you need to admit them, not let them go. And you can, even if they say we don't know, no, this is not happening, I don't care, I don't believe you hardly know my family, you can very well say that we really don't know what might be the causes of bruises or cause of fracture, but until we further investigate, I would like to, admit or keep her here, and we might be able, we will be discussing further with my senior as well. And you need to, in case of abuses, you need to understand like, you need to understand that if they say that I don't want to do any test because I'm not comfortable with it, you need to respect that. You need to respect that and say, it's all right, okay, if you don't want to do it, it's completely fine with me. If you don't want to approach, if it's a like if it's an adult, if they say that they don't want to involve the police because they might harm them further, then you try convincing them. But even if they don't do so, they don't get convinced, then you need to respect their decision ki, all right, okay, if you don't want to involve the police, then it's all right. Am I clear with everything? Is that all right with you? Is there any questions?
Yeah,
Anyone wants to add?
I want to add something.
Yeah.
So in case of sex trafficking, like Anaga said, there could be a scenario where the child would have got badly bruised or injured. And the child or adult who's getting abused might come to the hospital with the abuser, and you should be able to find out where is the abuser. And sometimes the child might tell you that the abuser is just standing behind me, is just outside. So you need to make sure the child is safe in these cases, and that is very, very important. So in case of adults also, again in rape cases, if the adult doesn't want to go to the police, that's fine, but you should also tell them that if you're not filing charges for after a certain period of time, you won't be able to file charges, and that might be a problem. So you should explain all of this to the child and to the adult about what is their decision going to do to them as well. Yeah, that's it.
And carry on to the next slide. Proceed with the next slide. Yeah, I think.
Yeah, so these are some scenarios you might get in your PLAB 2 exam. So this is basically a scenario where the patient, has an RTA, and the patient was totally fine after the RTA, and so the patient is being discharged, because the patient is completely fine. But after 2 weeks, patient comes in and asks for a sick note, where they might tell you, doctor, I have taken this amount of leave in my work, and I need you to write a sick note telling that I was injured in the RTA and I need sick leave. So in these scenarios, you should understand that you can't lie about what happened to the patient. Again, after 2 weeks, you can't change history and everything. So you need to sit with the patient and take a brief history about what happened, find out the reason why they're asking the sick note, and you should tell them why you won't be able to give one, because you can't change medical records, and you can't change what happened to the patient, and you can't lie on your on a legal paper document. This is one scenario you might get. And again, this is a patient refusing treatment. So you might have scenarios where patient comes with a very emergency condition. So, for example, patient has diabetic ketoacidosis, and the patient comes to ER with acidotic breathing, and patient is sweating, tachycardic, and you check and you investigate and find out the patient has diabetic ketoacidosis, but the patient might tell you, no, I have to, my daughter's wedding is tomorrow, so I have to go to my daughter's wedding. I can't get admitted here. That's not possible. So in these cases, you have to, again, safety of the patient comes first. By safety, you have to assess if the patient, again, has mental capacity to understand what she or he is being told, and if they totally comprehend it and they can make a decision for themselves. So you sit with them, check their capacity, ask the reason why they don't want to get admitted, and you have to sit and explain about the condition, why they should get treated, and what will happen if they don't get treatment. And you can also try to address the reason for refusal if it's an addressable situation. But ultimately, you should know that patient's autonomy, patient's decision is the final. If the patient doesn't want treatment, the patient doesn't want treatment. You can't do anything about it. Now, do you guys have any questions at this point? Okay, so before we move on to scenarios, I'd like to discuss 2 or 3 more things, which is very important, and in the recent times it's been more stressed upon. So all of you should get awareness about LGBTQ community, and in many ethical scenarios you get these questions about LGBTQ communities. So I will give you 2 or 3 examples now to get a brief idea about what is happening, and how these scenarios can come. So you can have women who wants to get pregnant, and so in these scenarios you shouldn't assume the partner is male. The partner might as well be female. So you should always have in mind, when a woman comes to your clinic who wants to get pregnant, you should find out about their partner's sex. If they are having a male partner or a female partner. In male partner, you have different management you can give, and in a female partner you have totally different things you're going to prescribe them to, and for getting a child. So you should be very careful in these scenarios and address it very delicately. Now, some of you might not have an understanding or might be against it, but when you sit for an exam, you should respect the other individual's life and their sexual orientation and everything that comes with it. So you should be very careful in these scenarios, how you deal with these patients. That is one scenario I want to talk about. The second scenario is, you might have adult male coming into your clinic, who is not talking so much, and you're discussing, and the adult male can tell you that the person got raped, and it was by someone like a friend or a brother's friend or someone like that. So you should again deal with these scenarios very delicately. You should ask, what happened? How did this happen? Is this the first time you are in a scenario like this? Has this been happening for a very long time? Were you in any consenting relationships before? And if a rape happened, how did it happen? Can we send you to analysis team where they can take swabs and all, and look, identify that person, and we can do something about it? Do you want to tell your family? Do you want to divulge this to the police? So you should be very delicate in approaching these scenarios. It could be another scenario where, you know, the person is a lesbian or a gay person, and, you know, they are being mocked at or abused mentally in their workplace because they are gay or lesbian. So again, in these cases, you should be very careful, you know, what you talk to these patients. You should be very careful about the words you're using with them, and you should, you know, deal with these patients very delicately. And then coming to another set of scenarios where you have an opposite view about some things. So let's say an adult is coming, you know, to your clinic, and you are an gynae consultant, gynae FI2, and, you know, the person wants to get an abortion done, but you are a Catholic and you don't believe in abortion. So in those cases, you can, you know, take a history of the patient, discuss with the patient about, you know, what they want to do, and refer them to a doctor who will be willing to do it for them. And you can politely tell them, I do not believe in this, so if I may refer you to another person who, you know, can do this. And I'm so sorry I couldn't help you today. So these are some of, you know, scenarios which you might also get in these ethical cases, you know, and you should be very careful how you deal with these cases. Now, do you guys have any questions? Okay. Yeah, Raja.
No, sir, you can proceed.
Okay. So can we go to scenarios?
Yes, sir.
Can proceed with that.
Okay, the first scenario, me and Anaga will do it, and, you know, from next scenario on, you guys can, you know, do
Pitch
it with
in.
us. Yeah.
Yeah.
So the first scenario is you're an FI2 in medical oncology. Ms. Fiona Cook, 73-year-old, has been under the care of your team for multiple myeloma. She is in a stable condition now. There is no lasting power of attorney or next of kin documents available. Mr. Steve Edmonds, a surgeon in a hospital whose her son is calling you on bleep to inquire his mother's condition. There is no consent available. Talk to him and address his concerns. So I'll be the son, and Anaga will be the doctor.
Yeah, okay.
We will do it.
All right. So, hi, good morning. My name is Dr. Anagha Vasant, one of the doctors available here today. So, I can see that in my notes that you came here to discuss about your mother. Isn't that right?
Yes, doctor. I'm a surgeon here as well, as you might have known. I want to know how my mother is doing currently.
Yeah, okay. Yeah, that definitely we can talk about it. But before we proceed with it, can I just confirm your mother's name and age, please?
My mother's name is Fiona Cook, and she's 73 years old, doctor.
All right, okay. And your name is, if I'm not mistaken, it's Steve Adams, isn't it?
Steve Edmonds, doctor. Yes.
Okay, yeah. All right, okay. So you wanted to discuss about your mother's situation right now, isn't that right?
Yes, doctor. I want to know how is she doing? What are you going to do for her? Is she fine now?
Yeah, all right. So, yes, she is admitted with us right now, and she is doing, she was not doing so well, and that is why we run through a lot of tests to figure out what really was going on. So, but there are still informations that that are like pending, and if you don't mind, can I ask you a few questions about your mom's health, so that I can understand your situation better? Is that all right with you?
Yes, doctor.
Okay, thank you so much. So, what might be the cause? Like, was she diagnosed with anything before? Like, did she have any issues before? Can you just run me through what really happened?
No, doctor. It's just that she was, you know, feeling tired a lot lately, and she was telling
All right.
she had all this pain all over her body. But,
Okay.
you know, we didn't know what was happening because, you know, I don't live with her.
All right.
Lives alone in her house, so she's been telling about this. but we really didn't know what was happening to her.
Okay. Okay.
And that is pretty much what I know as of now.
Okay. All right. Perhaps did she have any symptoms wherein she had any recent fractures? Did she fall anywhere?
Yes, doctor. Yeah, she did fall
Okay.
recently, and we had taken her to the hospital as well. But
Okay.
we couldn't, we thought because she was very old and, she was
Mm-hmm.
fragile and, she could have fallen, by mistake, but
Mm-hmm.
we didn't know what is actually happening. So, what is actually happening to her, doctor? Is she all right? What happened?
Yeah, definitely we'll come to it. But before we just talk about it, I need to understand a few more things so that I can answer your questions better. Is that all right with you?
Okay, doctor.
Okay, thank you so much for your patience. I know you're very anxious about your mom's situation. Thank you for your cooperation. So, before we proceed with it, did she have any medical history? Did she have any comorbidities as such?
I think she only had, hypertension for quite a while, but she's
All
been
right.
taking medications regularly, and she's
Okay.
been visiting her GP regularly as well.
All
So
right. Okay. So
nothing
she's on a
bad
follow
happened.
up for that.
Yes, on a regular follow.
Okay. That's good. That's good that she's maintaining it well. Apart from that, do you have any family history of any diseases as such?
As far as I know, like my father didn't have. I think my father only had diabetes, and one of my uncles had multiple myeloma.
Mm-hmm.
Yeah.
Okay. All right. And how are they doing right now, if you don't mind me asking?
So, like I said to you, my mom lives alone. My father have expired,
Okay.
2 years.
I'm so sorry to hear that. Are you all right to proceed with the consultation?
Yeah, yes, doctor.
All
So,
right. Okay.
and my uncle who had multiple myeloma, he was being treated for the same as well for quite a while, but then he expired as well.
Okay. All right. And how about any allergies? Does she have any allergies?
Not that I know of, doctor. No.
Okay, all right. And she's taking only one medication for her hypertension, isn't that right?
Yes, yes, doctor.
Okay, all right. Did she happen to, is she managing everything on her own, even though she's living alone?
Yes, doctor. All these
Okay,
years she's been managing it on her own,
all right.
since
Okay,
till the recent fracture and tiredness.
okay, okay. And how does she manage her diet and exercise? Do you know about
She,
that?
she cooks. She pretty much wants to do everything on her own, and she
Mm-hmm,
insists on it. And she doesn't want anyone's help. And
mm-hmm.
so, yeah, she cooks for herself, and she eats. And once in a while, she travels and comes and all.
All
So
right.
she's all right.
Okay, that's good. That's good. And how about smoking and alcohol?
Back in those days, I think she used to drink a bit, but then not now. Nowadays, not so much.
Okay, all right. Okay, so we do have the reports with us right now, and we have the diagnosis with us. But I'm afraid that I cannot give you the diagnosis right now because, as you very well know, the fact that we doctors cannot divulge the information.
Yes, doctor, but
Yeah.
I'm a surgeon in this hospital. I'm not going to tell anyone. It's
Yes. Yeah.
I want to know what's happening with her.
Yeah, I completely agree with you. And you seem to be a very concerned son, and she's lucky enough to have you, but have you as a son. But however, there are certain protocols we need to, we need to follow. And if you don't mind, we equally value your input as well, because in the end of the day, she needs you and she needs the support as well. And so, what I'm going to do is I'm going to discuss the diagnosis with my consultant and my seniors with your mom, and we are going to ask her if it's all right with her to involve you as well. And if she gives us the consent, then we can very well continue and involve you as well. How does that sound with you?
Yeah, okay, that's okay, doctor.
Okay, thank you so much. Is there any other things that you want me to clarify?
No, doctor. This was
Okay,
pretty much it.
thank you so much. We value your input as well. Thank you.
Thank you. So, anyone has any doubts in this scenario?
So how we approached the case is that we took a brief history. We searched if she had any symptoms. We asked them to recall. We looked into any risk factors if she had, so that I can answer that questions. And then I slowly came up with an alternative instead of just straight away saying, ki, no, we cannot do that, because they don't like hearing no. People don't really like saying hearing no, right? So we need to, find of alternative ways. We tell them that you are a good son, and we value your input as well. And how about we just have a meeting together, and we can discuss what needs to be done. So that is how you approach the cases like this when the
Yeah.
patients are difficult.
Yeah, just to add, yeah.
Yes,
So
sir.
if you see how Anu and CB did it, the most important thing in all these scenarios is what we expect from you is that you should not panic in the situation. That's the most
Yeah.
important thing. You should not show your anxiety. At the same time, you should understand what is the thought process of the person listening to you, and you should cater your talk based on how they behave and how they take it up. Yeah. So if you see Anu's pronunciation, it was very, very clear. It was not in rush. It was not in bits and pieces. And as she added on the information, she took the input from the other person to know where the other person stands, and then she added on the information. So this is exactly what we need. So we don't want anyone in the NHS who comes in and makes our patients worry. Yeah. So whatever the diagnosis it is, it all depends upon the way we tell the patient. Yeah. So even a patient who is going to die tomorrow, we can tell in a very reassuring manner that the patient might feel okay, happy. Yeah. So that's the most important skill which is very, very vital for junior doctors or anyone who's planning to come into UK. And all these things are considered very, very seriously. So if you see every day as a consultant, we get a lot of datex and the incident report data coming to us telling that this particular doctor has behaved in an unprofessional way with the candidate. If you go and see, there wouldn't be anything. They will just say that the junior doctor who came and spoke to my mom wasn't polite. They were quite harsh. They were in rush. So the patient can easily understand. For example, 4:30 in the evening, if someone is asking a consultant, asking a junior doctor to go and do this, if that junior doctor has some work in next 15 minutes, and if this is a scenario she gets. So that is a very, very important thing. And the patients can easily pick up that you are rushing the situation or you're trying to vomit out whatever is told to you. So that anyway, so according to them or according to the junior doctor, they don't need to come and face the patient again tomorrow. Yeah. So it's very, very important to understand that these situations or these scenarios are very, very, very sensitive, and you need to spend time and you need to calm down, relax, understand the other person's mentality as we move on. That's the most important thing. Yeah. But whatever they did was, like, I would say 100 marks out of 100 marks if I was supposed to give marks. But this may not be the situation in the actual exams with so much things running here and there, stressful, noisy. Yeah. But it's a very good, depiction of how it needs to be done. Good.
Thank you, sir.
And might I add, like in cases where you have patients, a son or daughter or anyone involved, you might as well have some finance and wealth involved. So you should be very careful about divulging information, because the son or daughter might not have lasting power of attorney, or so one of the siblings might have it, or the patient might have a will which does not include their kids. So you should be very careful about the scenario you're dealing with in these cases. And and one other important thing in this case you need to understand is, you should try to understand how much the attender or the bystander, son, daughter, husband, whoever it is, knows about the patient. You might be dealing with an attender who doesn't know anything about the patient but will pretend to know things about the patient. So you should be very careful in dealing in these scenarios with whoever wants to talk to you, and tell them politely in a way that the patient has mental capacity, to understand what the patient is going through, and they will decide, what is going through. Now, some people have doubt that if there is a lasting power of attorney or if there is next of kin document, should I divulge this to the patient's next of kin or LPA? Now, again, it comes back to mental capacity. If the patient has mental capacity, don't divulge it to them. If the patient doesn't have mental capacity is when LPA or next of kin is applicable. Otherwise, it's not applicable.
Yeah.
So
That is if the patient is actually an elderly with dementia. So she doesn't have really the capacity. So the question might itself say that, the patient does not have mental capacity. So in those cases, again, those are exceptions for breaching the confidentiality. And that's when you can actually, explain it to the bystander as well. And many of the time you might not know what is going on, and that is why the necessity to recall from them, make them talk what really is going on, asking them, can you just quickly run me through what really is happening, if so that I can understand what is going on and I can answer your questions better. That's how you deal with such scenarios, as always.
Yeah, now going to the next station, who wants to do it? Raja, Dr. E, Dr. Harshavardhani. Who wants to practice?
Who wants to try, guys? Just do it. Come out. Volunteer yourself.
We're not going to judge you anyways. We all have
Exactly.
been
So
here.
this is just a place where you can test, do some game. It's just like playing a demo game before a proper video game.
Yeah, you can very well make mistakes here so that you don't make mistakes in the exam.
Okay. Harshavardhan, you want to do?
Okay, sir.
Rajshekhar, yes. Good.
I'll try.
Yeah.
Okay, so you are an FY2 in general medicine. Emily John, a 28-year-old teacher with type 1 DM, presents with abdominal pain today. Investigations are suggestive of DKA. She is not willing for admission. Talk to her and address her concerns. Now, ideally, this is a condition where you get, it comes to A&E. So let's take it as you're an A&E. And the patient is getting admitted. And I know I'll give you about 1.5 minutes to think, and then we can start. Okay?
Okay, sir.
And we'll help you out too, so don't hesitate.
Okay. Shall we start?
Yeah, we can start.
Okay. Hello, I'm Dr. Raja, one of the junior doctor working in this hospital, and I will be your treating doctor for today. So before proceeding further, can you tell me your name and your date of birth for the record?
Doctor, I'm Emily John.
Okay, hello, Emily John. It's good to see you. So tell me, Emily John, what brought you here today?
Doctor, I had abdominal pain, and it was there from the morning, but then by the evening it got very bad, and I couldn't do anything about it. So I thought I'll come to the ER, get a quick checkup, and go back home.
Okay, I understand that it must be really difficult for you. So, can you please elaborate more about this pain? Where exactly this pain, and can you describe more about it?
So, doctor, today morning, I was running about in the house, for work, and suddenly the pain started in my stomach, and I thought, okay, if I take antacid, it'll get better. And then I took an antacid. It got better for a while, but then it got terribly worse after that. Then I thought, okay, the antacid is not working, might be something bad. So I thought I will come to the hospital today and get it checked fast and go back.
Okay, okay, fine. Can you tell me about your medical conditions? Do you have any other conditions like diabetes or elevated blood
Yes,
pressure?
doctor, I am diabetic.
Okay, are you taking insulin or any medication for it?
Yes, doctor, I'm taking insulin.
Are you following it regularly?
Yes, doctor, I'm following it regularly.
Okay, fine. Now that you said that you're diabetic, I would like to order some quick blood test.
Okay, doctor.
Will that be fine for you?
Yeah,
Okay.
doctor, no problem.
Okay. I think I have your blood test right now, and it shows that your sugar level is elevated, and as it level acidity of your blood is also pretty much elevated. We call this condition as a diabetic ketoacidosis. Do you have any idea about it?
No, doctor, but are you going to give me some medicines, to reduce the blood sugar so that I can go back home? I have something very important
Uh,
happening tomorrow morning.
uh, I'm sorry, Ms. John. I'm sorry to say this. Unfortunately, it is an emergency acute condition. So I
Okay.
think I must admit you to
Doctor,
proceed for the treatment.
I don't think I want to get admitted because, my brother's wedding is tomorrow morning and I can't miss my brother's wedding for the world. And,
Okay.
I've been doing, a lot of prep for my brother's wedding for about a month now. So, no, I don't want to get admitted, doctor.
Okay, I can understand. I can understand. I agree with you. I completely agree with you. Your brother's marriage must be quite important, and you can't miss it. But you also must understand the seriousness about this condition. Do you have any idea about this condition? Do you know
Uh,
what diabetic ketoacidosis means?
no, doctor. What is it, doctor?
Okay, no problem. I will explain it to you. You know, see, whenever the blood or body cells cannot use the blood glucose, instead of sugars, it use our fat, it digests our fat and produce lots of acid. If
Okay.
the acid level in our blood rises to more than critical level, then it is called as diabetic ketoacidosis. It is
Okay.
quite detrimental to our health. So it needs urgent attention.
Okay.
That's what you have. So for that, you need to be admitted soon. I think we'll ask our GP consultant to have a consultation with you, and we'll also run further tests to check your electrolytes level, and we'll be giving you some fluids because obviously in this condition you will be dehydrated so much.
Okay.
So we need to correct your water levels.
Okay.
Am I clear so far? Or do you
Yes.
have any doubts?
Yes, doctor. What will happen if I don't get this treatment right now? I just, go to my brother's wedding and come back tomorrow evening and get treated. Is that all right?
No, as I said that in this condition, one of the most severe complication would be dehydration. If there is inadequate volume of blood, then there won't be enough blood to be supplied to vital organs like heart and kidney. So this can lead to the failure of those organs. It can occur in matter of days. I'm really sorry to say that, but it could possibly can happen.
Okay,
So,
doctor. So you're telling I might get dehydrated. So if I keep drinking water, for the whole day, will I be fine?
but the actual cause for the dehydration would be because of your body could not use the sugar level.
Okay.
Okay, so we need to correct that cause. We
Okay.
can't do a symptomatic treatment. So we also both should go hand in hand. We need to correct your water level as well as we need to correct your sugar level.
Okay,
Okay,
doctor. So if I
so
get treated, when will you leave me? When will this treatment get over? When can I go back home?
actually, we before discharging you, we must make sure that all your electrolyte level and the water levels are at optimum level before we discharge. So I think it will take 1 or 2 days.
Doctor, but my brother's wedding is tomorrow. I'll think about it, doctor.
Okay, okay, Emily, but it is advisable. It is advisable to this condition to have an admission and to get treatment as soon as possible.
Okay, doctor.
So I will ask my senior consultant to have a discussion with you.
Okay.
So he will be a better person to clarify all those doubts for you.
Okay.
That be fine?
Yeah, doctor. Okay. Okay. Yeah. End of scenario.
Yes, sir.
Okay. Yeah, 1 more minute left, but very good, pretty good.
On to the next section.
And you covered most part of it, and you persisted with your, thing to, get the patient admitted. And I would give you 2 or 3 suggestions. You ask the right questions. You ask the patient had diabetes, and you ask the patient if they had insulin. You should ask if the patient took insulin today morning. Because the patient told you they've been running around, for their brother's wedding. Did they take food properly for these past few days, and did they take insulin for the past few days? If you ask them, have you been taking insulin like as prescribed for a long time? They say yes. But DKA is a condition that arises in 1 or 2 days where they have been properly, they have fasted, but they have been taken insulin. Or so there is a improper balance between diet and insulin taking. So you should find out the reason, and you should tell them that is the reason why you ended up this situation, and that is why this might cause harm, and the rest all was perfect. So you explain what is the condition, what will cause it, what will happen if the patient doesn't get treated, and you persisted with whatever questions the patient asked. All good. And so if you could try to get the patient to say why the patient got this, it would be perfect. Okay.
Okay. Thank you.
Okay. Yeah, Anaga, do you want to add anything?
No, it was fine. You could probably in the end, when even they most of the time they might not even agree to you. So that's just they're just trying to put you in a difficult position. So you need about how would you handle such a case. They just want to test you more. So instead of getting more anxious about it, it's natural to get anxious about it. Yes, even I would definitely get anxious about it. But it's like Sir suggested before, we have to see how we can, convince them. So even if they say, no, I still want to go to this thing. So you need to say that, I would recommend you, use the word more like recommend. I would recommend you, with all due respect, I understand how it is important to you. And even if I was in your situation, I would feel the same way. But I would recommend you to stay here, because even if so, this is completely dangerous to your own health. And even if you go and don't get admitted, you might fall down tomorrow as well. Like, your health might deteriorate there as well. And you can give them alternatives, like what else can you do? So even though I understand how important it is, maybe perhaps you can attend it through a video call. I'm sure that we can discuss this with your family members as well, so that they can also I'm sure that they would also agree with us, because your health comes into your utmost priority. So words like this is going to help giving them alternatives, and telling them that we both are in the same page. We are here to help you out, because we don't want you to deteriorate. So telling them that, assuring them that will help them get convinced. So are you understanding me? Does
Yes,
anyone
ma'am. Yes,
have
ma'am.
any doubt?
Yeah, one more thing I want to add is you can safety net at the end, saying that if you're
In
taking,
case, yeah,
if
safety
you
netting is very important.
take
In
food,
case you have this again, please don't hesitate to come back to us again. I'm sorry, even if they don't, in the end, like, even if they don't agree, you can say, I'm sorry, I couldn't convince you. But, we can perhaps arrange a meeting and discuss this further if you don't mind. So, yeah. You can very well handle it further as well. You did a fair good job also, but fine. Giving them
Okay.
alternatives always works. So yeah.
Okay. Okay.
Okay.
Thank you. Thank you.
okay, the next scenario, doctor, are we
Doctor,
supposed to give an exact time, how long we need to admit the patient?
um,
Yeah,
in cases where it is like post-op cases where you know how long the patient is going to be there, maybe yes, you can give an exact, because those are the cases they have doubts about the post-op, like post-op TKR cases where they say, ki, when can I start going for job, when can I take a bath, when can I actually start driving again, because I would be using my leg, because that involves again DVLA. So you need to be, it depends from cases to cases. In this case, well, since this is an acute condition, this is an emergency condition, you need to assess the situation that you are in and be diplomatic when you don't know about it. So because you cannot give them a false hope either.
and
So
you can
in
give
cases,
maybe a timeline of
yeah,
much time it can take or how minimum it can take, and based on
yeah.
their condition, how much maximum, because
Give them a range, like post-op after TKR, when can you start driving again, or can you go back to work? So ask them first, what kind of work does it involve? Like, is there something that you have to do on the side, or is it something that you can work from home as well? So that you can talk with manager as well. So giving them an alternative instead of saying straight off no is what, how you, it's a convincing skill that you can learn to do so. So you can say, usually you tell them, like, usually for patients after TKR, they after 6 weeks they can actually go back to work, but it also depends on what kind of work is involved. Is it something that you have to stand for a long time, which would cause you more pain? So perhaps you can talk to the manager saying that, after 6 weeks, you can't do it. So is there any alternatives that they can help you out with? So things like that, it is different for different scenarios. That's what. And give a range,
so
like
in
2 to 4 weeks.
acute cases, so you can give them a realistic timeline, because why I would suggest that is, if you give them a wrong hope that tomorrow morning you can get discharged, and if a patient is actually
Hmm.
unwell or gets deteriorated by tomorrow morning, that's a false hope you're giving. So don't tell
Yeah.
them. Give them a realistic time range. See, you might get better by tomorrow morning, but we're not sure about that. And I sincerely hope you get better by tomorrow morning and you're able to attend it.
Yeah.
But it might even take longer for this condition to subside and for you to get better. So ideally, I would tell you might get admitted for about 1 or 2 days, and so I want to, I hope that it gets better faster so that you can go back home.
Yeah.
That's it.
Even in cases of breaking bad news, wherein they ask you a direct question, doctor, is my father going to die? How would you answer that question? You can't give them a false hope. It's all right. Maybe tomorrow he's going to be okay. So if you give that, there are cases where you can't give a hope to them. So you need to say that you need to emphasize the fact that it is a serious condition, and it is less likely to benefit him in any way. And it is, I'm afraid that it can deteriorate at any point of time, and we cannot really predict how it is going to go. So that again is something that you have to deal with delicately. You have to deal it with. If he tells that his insulin properly and insisted to get, I
Not
didn't
to
read
get
it well.
insisted not to get admitted. How do we go about it? If can we accept it and let them go? Yeah, that is where mental capacity comes to the
Mm,
front. If you feel that patient knows exactly what he's talking about, understands the complications of it, understand what will happen if the patient is not going to get the treatment and still wants to leave the hospital, you can tell them, I will ask my seniors to come and talk to you, and if you're still not convinced, okay. But
I'm sorry about that. I couldn't convince you.
or if they insist, no, I want to go home right now, and if you feel they have mental capacity, it's their right to go home. You can't do anything about it.
You need to respect their
Wishes.
opinion. Yeah.
Dr. E, any other question?
They'll be very happy to clarify.
Okay, thank you. So the next scenario, who wants to do? Dr. Harshavardhani, yes. So you are a FI2 in GP. Miss Julia Holding, aged 14, has come to you with concerns. She had unprotected sex. Talk to her, assess the situation, and address her concerns. So we'll give you about 1.5 minutes for you to, think about the scenario, and then we will start.
Yes, sir. So can we start?
Yeah, we can start. So yeah, we can start.
Good evening. I'm Dr. Harsha, junior doctor available here for the day. Can you tell me what you hear?
So, doctor, I am here for, I'm here for something, doctor.
Are you comfortable talking to me, or you want someone else with you?
No, doctor, it's fine. I'm comfortable.
Okay, let me tell you something. Whatever you tell me, I promise you that it will be only between us. I'm not going to tell this to anyone else. So feel free to talk. You want some male doctor to come here, or?
No, doctor, I'm fine. So I think I want the morning after pill. Can I get one?
Okay, Miss Julia. Can you tell me what really happened that you're asking for a pill?
Doctor,
I understand it's very difficult to talk about this, but I need to know some information before prescribing you any pills. So,
okay. So, doctor, I had sex with my boyfriend, and I am afraid I might get pregnant. So I want the morning after pill. I don't want to say anything more.
Okay. Please don't worry. It's fine. If you're okay with it, can you tell me what's the age of your boyfriend?
Why do you want to know that, doctor?
No, I must know if you're aware of if you really have consent. You did this with the consent, or?
Yes, doctor, I did this with consent.
All right. So. Okay, so is it fine that is it fine just giving if I give you just a pill, or you want some other assistance?
No, doctor, just the pill for now would be fine.
Is your I think your parents must not be aware of this, right?
No, doctor, please don't tell my parents. I don't want them to know.
Okay, fine. I don't know what else to say, ma'am. Yeah.
It's all right. It's quite difficult, but
my partner is my math teacher.
Okay, so I think we must. I think this information must be known to your parents as well. It would be better if you
No,
tell.
I don't want you to tell this to my parents. I think they will kill me if they know this.
Okay, but your teacher is someone who is in possession of trust, so it's really not fine that this has happened. It is better to involve the police and.
No, doctor, no police. I don't want anyone to know about this. I just want the morning after pill. You give me, I will go.
No, I understand your situation. You must be really afraid that this might be a big issue, but it's more important that you're safe. You're safe because just by giving you pill, there could be this could again happen, right?
Yes, doctor. That's why I don't want to get pregnant. That's why I want the pill, and I want to just have the pill and go back home. That's it.
Do you think by any means this was a abuse?
No, doctor. He was fine with me. He didn't do anything.
Right. Miss Ma'am, can you help me?
It's okay. It's a difficult situation, and all of us struggle with this case always. It's a very delicate thing, like we said. So, do you want to do this again, Sebi, if you wish to do so, run
Yeah.
through so that we can give them an idea?
Yes. Yes.
Yeah. So, can you start over from the beginning?
Yeah. You can start the scenario. One second.
Yeah.
Just give me.
Digestive disorder, GI bleed, liver disease, endoscopy, colonoscopy surgery.
Anyways, Harsha, it was a good attempt. Don't worry about it.
Yes.
This
Yes.
is how we all do it, and we struggle with it. But in the end, it's just a few more practices, and that's how we all learn from it. So don't worry. Don't be so harsh on yourself. You tried your level best. So how we approach is. You introduce yourself. Hi, I'm Dr. Anagha Sund. I'm here to help you out. So, how can I help you today? So, Sibi, on to you.
Doctor, I came here for something.
All right. I can see that you are very uncomfortable right now to talk about it. Is there something concerning you?
Yes, doctor. I want the morning after pill.
Yeah, all right. I can understand. I can see that it's really hard for you to come here and talk about it and ask about it. I can surely help you out with it. But before we proceed with it, can I ask you a few questions if you don't mind? So what I did here was I acknowledged that the nonverbal clue of she is not comfortable to talk about it, and I acknowledged it by saying that I can see that you are actually not comfortable to talk to. Is there something concerning you? So instead of straight away telling them, okay, something's wrong, just give them a position key. I can see that, acknowledge that emotion that they're having, and then proceed with it. And then you ask them to recall. Then she might be opening up. She might not be mostly opening up again. So I'll be telling her, this is a safe place to talk about whatever you talk to me. It stays between me and you. But however, any information that provided that the information that you provide is not harming anyone or yourself, so you can definitely talk about anything, and I'm not going to judge you for it. Then only the patient actually opens up to you, saying that I had a physical contact and this is not something I'm comfortable to talk about. And then only they might say ki, this happened. And then again, like I mentioned, that here you need to take there are two patients here. One, the patient himself sitting here in front, and the partner. So again, you need to ask, can you just tell me how is your partner's age, and what he or she does for a living, what kind of relationship do you have? So you need to ask about that. So are you comfortable to talk about it, if you don't mind? So giving them an option so that they also feel safe to talk about it. And then further on, they might tell you, ki, this is happening, and he's my teacher, unfortunately, and this is something that I'm not comfortable to talk about. So I'll approach it saying that, I can understand that it's difficult for you to come here and ask for it, but then I check her mental capacity to because she's only 14 years old. So I need to assess her mental capacity. So I ask questions like, do you understand what will happen if you don't take contraceptives? So, and especially the second question you can ask is, do you know what exactly will happen when you don't use a condom? Because a condom not just prevents from getting pregnant, but it also helps you from preventing getting any sexually transmitted diseases, which the other contraceptive ways don't do it. So you're assessing that mental capacity. And when they admit that, you need to acknowledge again their emotion by saying that, I really appreciate that you came here today for asking it instead of going somewhere else and taking it yourself. Because you need to understand that this is a kid who's coming, and you need to win their trust as well, so that you can flow them through and make them reflect that what is happening is not really right. So that is why you need to tell them, ki, I really appreciate that you came here today to talk about it, and you ask her about any what are the contraindications of taking a contraceptive pill, like the OC pills. Whether does she have any migraine, does she have any hypertension, any of the contraceptives that we know about, obesity, all those things, PCOD, and all those things needs to be ruled out as well. Then after that, we can say that slowly, then you say, break it down to them. I'm afraid I can't really help you out. Then you need to push them as well towards the end to talk to their parents, because this is a minor coming to you and asking you for contraceptive, which is not really advisable to do. But however, she came to you to ask about it instead of getting pregnant as well. So sometimes the patient might break down and say, I am pregnant, doctor, nobody's there to help me. So you need to reassure them, saying that, don't worry, we are here to help you out. You're not alone in this. What happened was not right. You need to you did the right thing to come today and speak about it, because this, whatever was going on with you, was not right. So give them that assurity, give them that space to feel safe. So when you do that, then they might be agreeing to you much more. Are you understanding me? Is everything clear to you?
Yes, ma'am. Yes,
ma'am. Yeah.
So I want to add something.
Yeah, sure.
So in cases where you have a minor and a person who's of a big age difference, or a person in a power, in a position of trust, a position of power, you should try to make sure that the child understands this, and the child tells you that no, this relationship is wrong. And that is when the child will, accept help. You don't, trust them upon them that, no, I'm going to do this, I'm going to refer you to social services, I'm going to call your parents. If you give all of this, the child will run away. So that is
they don't force them, but instead make them feel comfortable. And to make them feel comfortable, you need to approach that case as a child. It's a child coming to you and asking you for help. So when a child comes to you and asking for your help, that's when you need to not scold them, which we usually tend to do. Instead, we tell them, you assure them, I will definitely help you out. Whatever it is the case, you're not alone here. I'm not going to judge you at any way, and I'm going to help you out. I will give you the contraceptive pill as well, because you did the right thing asking for it. You are a mature girl to understand the importance of contraceptives. So, but then, however, whatever is happening with you is not right. So I'm afraid I might have to, unfortunately, involve the social services as well.
And one more thing about this is, usually children at this age who are involved with sexual relationship with adults, the abuse part is there. You were right to ask about the abuse, and all. If the person is abusing you, don't ask it straight away, like, is the person abusing you? No. You can tell in more calming differences is, does the person force himself upon you, or the person insists that we shouldn't use condoms? These are all things which will suggest that it is an abusive relationship.
Yeah, that's right. So you can, there's a flow that you need to, first itself, you cannot ask about the partner. So there is a flow of questions that you need to ask so that you go into it. And then, you put there and slide the question slowly in. Like asking them, are you sexually active? Then they might say, yes, I am sexually active. And then, do you practice safe sex? So they might say, no, doctor, I don't practice safe sex. That is why I'm here to talk about it today. Then you acknowledge that again. Oh, I'm so happy that you came here to ask about it. I'll definitely help you out about it. Then you ask them, do you have multiple partner or a single partner? Then they
How
might
long
say,
is the
okay, and
relationship?
how long has this relationship been? Is there is if at any point of time did you feel unsafe? Did you feel like, and then you ask the indirect questions that Siddhi actually suggested, which indirectly gives you clue that this is not right. And then you throw them the question as make them say ki, do you think that is right actually? Do you think that what is going on is actually wrong? So you make them say it. That is how you can approach this case. I'm sorry if I cut you off.
So yeah, did we give a clear idea about the scenario? If you have any more doubts? Dr. Harsha?
No, sir, it's clear. It's clear now. Yeah.
Yeah, okay. So yeah, basically you divide this into two parts. You approach the, sexual activity part, and you also, when it comes to the morning pill, you do a brief medical history as well to find out if this can be given to the patient. You do both, and you close the scenario. It shouldn't be very hard, but initially you should make sure the patient opens up. That is where it all is there. Okay, so moving on to our next scenario. So who wants to attempt this? Who would attempt? So Dr. E, Dr. Bantika. Or anyone who's attempted previously also can do it.
The question seems very big.
I can try.
Yeah, that's good. Thank you.
Okay, Dr. Anaga, take it.
Yeah, sure. So you're an FY2 in the GP practice, and Mrs. Jordan West has arranged an urgent appointment with you to talk about her daughter. Okay, her daughter Katie is 15 years old, and she wants to talk to you since she has some concerns about her daughter. The husband, the mother, and the daughter have been registered in this clinic for 15 years, so they're a regular visitor. They come for regular checkups. That is what is your understanding. This is the first time you are seeing anyone from the family, although. Okay. So please talk to her and address her concern. So what is your understanding? First, analyze it. You are an FY2. You are in the GP practice, and the mother is coming and asking you questions about the daughter. So what is this scenario testing you for? You need to understand that, and that's how you need to approach it. Am I clear with it?
Yeah.
Okay, all right. So I'll give you 1 minute. Sibi, can you start the timer as well?
Yeah.
Okay, thank you. So do we begin?
No. Like, there's 1 minute.
Doctor, I'm ready to start.
Okay, let's start.
Hey, good morning. I'm Yvonne, one of the doctors over here. Can I know what's your name, please?
Yeah, my name is Mrs. Jordan West, and I am 35 years old, and I'm here to talk about my daughter. I'm really concerned about her doctor.
Okay. Hi, Mrs. Jordan. Can I know what's make you worry about your daughter?
I recently found out that she is using contraceptive. I found it in her room, and I don't like the fact that she was prescribed because she is just 15 years old, and I don't think that's the right thing to do. What are you guys doing? Like, I know that it was prescribed by the doctor, so what is going on? Can you tell me why, if she came there, what happened? Why did you give her? Like, I want to know about everything that is happening. I'm really angry about this.
Okay, yeah, I understand your worries, Mrs. Jordans. Can I ask, is your daughter along with you today?
No, she's not here with me. I'm here alone because she was like, she didn't, when I asked her, she said, no, it is not mine, it is her friend's. So I'm really frustrated about this, and that's why I decided to just ask you about this.
Okay, can I know more about your daughter conditions for the past 1 month? How is she doing so far?
Well, she's doing fine. She just doesn't listen to me at all. She goes around with some guy all the time, and I'm really irritated with it. So, can you just cut the crap and like just go tell me what is happening?
Yeah, I understand that your concerns about your daughter, but I still need to gather some other information so that we can discuss about it better.
All right, fine. What do you want to know?
Okay, so how is your daughter doing so far? Is she having any other issues, any medical conditions before this?
No, she doesn't have any medical conditions.
Is she have any medications or food allergies?
No, she doesn't have any allergies. She's not taking any medication, but I'm suspecting that she's taking these pills.
Sorry?
She's not taking any medications. She
Okay.
doesn't have any allergies.
Okay. Just now you mentioned that you're not really happy with your daughter going out with different friends, is it?
Sorry?
Just now you mentioned that you're not really happy that your daughter is going out with different friends.
Yeah,
is it?
yeah. I'm not happy about it.
Okay. Can you tell me more about that? Do you know that how often she's going out and meeting people, which she doesn't really know about?
Yeah, she just hangs out with them all the time. I don't think that's important. I just want to know who prescribed it, who's responsible for this. I'm really angry about this. She's just a 15-year-old. I don't think that is appropriate to do so, and I want to complain about this.
Okay, Mrs. Jordan, I really understand that you are worried about your daughter, but I think there will be a reasons behind why contraceptives is actually prescribed to your daughter. So we need to discuss about it further.
So what do you mean? Did you actually prescribe her the medication?
No, I'm not the one, but I think we need to discuss about, we need to know more about your daughter so that we can know what is the reasons of the contraceptive
What do you
being
want to know
prescribed.
about her? I already gave you all the information. And I don't think there's furthermore anything. Just tell me who did this, and I'm really angry. So tell me who prescribed her. What is going on? Why does she want this contraceptive? She's just not talking to me at all. She's not opening to me at all. She's saying it's her friends, but I think I'm very sure that she is lying to me. I'm sorry if I'm being very rude, but this is how the situation is most of the time. Yeah.
Mrs. Jordan, I think it's good for you to have conversations with your daughter so that maybe she can open it up to you.
That's the way you are supposed to approach. So you suggest them that, this is, have you talked about it? First of all, you don't actually tell them that your daughter came here. You're not even supposed to say that. So you're supposed to say, I'm not sure what is actually going on. I don't know if your daughter came here as or not. So you do not admit that this such and such person came to us asking for this. You do not even give that information, because if you're doing that, you're giving away the information, right? Which is not right. So you do not admit it. You say, I'm not quite sure what is happening because I was not there. And so to help me understand, can I ask you a few questions? And like you said, you play around the bush, you ask them about their medical history and everything, but you have to manage time. So you ask them, where was I? I'm sorry.
Ask them questions.
Yeah, ask them few questions about their medical history. And then you suggest again the alternatives. Tell them ki, have you spoken about it to your daughter? She'll say, no, I haven't talked about it. She's just not listening. I've tried, but it is not happening. Then you ask her again the alternative. Have perhaps your partner or someone close to her has spoken to her so that she's much more comfortable with them. Then so she'll say again no. Then you need to tell her other the alternatives. So I'm not quite sure what happened here, but it's definitely something that is a mother can be worried about. I can understand that you're worried, and your worry is actually definitely valid. So you need to again tell them that, reassure them. You get that point? You need to always reassure the patient, whoever it is, whether the patient is always angry with you, whether he is demanding for something or not, so that you bring them into your team. You convince them that way. So you tell them, if at all someone like this comes, you don't tell them that she came. So if at all a child approaches to us regarding this, she will be what we do is we advise them to talk to their parents first, and we assess their mental capacity. If we find that the child is actually mentally capable to understand the seriousness and the complications of it, then we look into what are the contraindications and what kind of relationship she is having, whether she is being abused or she is having a consensual relationship. So you need to assess all those factors, like how you approach a case that we did previously. The same way you need to explain it to her that if a kid comes like this to us, this is how we approach. But I'm not sure if yours then you say, if she still pushes you, no, 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 tell me what happened, tell me if my daughter came here or not. Then you tell her finally that I'm afraid I cannot give you that information, because we need to maintain that confidentiality. It's a protocol. But however, if a child like this comes to us, we don't give them unnecessarily any pills. We assess if they are understanding this, and then only we prescribe it. Am I clear with this?
Yes, doctor. So actually, we need to reassure them that we prescribe the pill.
No,
for
you
reason,
don't.
do we?
We don't really reassure them that we did. We don't even admit that such a person came. But if someone of her age came, this is how we approach it.
You can tell ideally if a
Ideally,
person
yes.
of that age came with this query, and we will assess them completely, see if they have mental capacity, make sure they're not in an abusive relationship, and then we prescribe contraceptive. And otherwise we wouldn't. And you can tell them, if you still feel your daughter is not telling you anything, you can book an appointment with your daughter, and both of you can come to us, and we can discuss this with your daughter. And if your daughter is comfortable, we can also sit with you, and we can, all three of us can discuss about this, about what's happening with the daughter.
Yeah. So again, give them alternatives. And you can even explore by asking, why do you feel that she's lying to you? Maybe she is actually helping her friend. Even if she is doing so, she is actually being a good friend, right? So because they are actually giving a contraceptive wherein they are actually smart enough, where so you actually brought your daughter well. So you can turn around the whole situation as well. But be very careful and do that only when they are not agreeing at all. I would suggest that you do that only towards the end.
Okay.
Yeah.
Doctor, so if at the beginning the daughter is actually with the mom, do we include the daughter together into the consultation room and we discuss it like among three of
You
us?
can always give them an option, and most of the time there won't be any a child present there anyway. But you can give them the option, ki if you want, we can have a meeting together to discuss about this,
Okay.
like Sibi suggested. Am I clear with everything?
Yes. If
Okay.
during the data gathering section, actually, what question do I need to ask?
Yeah, so
besides,
you know first of all, you need to, when a question appears to in front of you, you need to assess what are they testing you for. You understand that this is a confidentiality and it is a ethics wala. And you need to, but you know that you cannot give the information. But you cannot say directly no. So you need to take a brief history, like you did perfectly. Then you give them alternatives. Okay, that have you spoken to her? Has your partner spoken to her? Have her friends spoken to her? They'll say no, no, no. Then you perhaps approach that I'm afraid I cannot give you that information. But however, if a child of that age comes to me, ideally this is what we do. And then after that you just need to play however they ask you. Like, you have to, there's no script here, there's no hard and fast rule that this is how you approach, but you need to improvise every minute, because that is how it works. Because if they feel like you are scripted here, that they negatively mark you if you sound scripted also. So you need to just be natural and have a flow of consultation when you approach such cases. That's what I would recommend you.
okay,
Am I
thank you,
making myself
doctor.
clear? Okay, thank you. Is there any other doubts that anyone has?
About anything, you guys have
Anything, yeah.
any other scenarios or any other things you have?
This is the last, right? We are finished, right? We're
Yes,
done. Yeah.
scenario. So you guys have any other queries or doubts or anything? And if you feel at this point you don't have any queries, you can always, give a text in the Telegram group.
Yeah.
We are here to answer you. And please feel free to give feedback for the session, and also please join us again after the new year, so on January 7th for
Yeah.
our next session.
If you really like the session, and if you like the way we approached it, and if you if you want us to improve on something that, or touch upon perhaps on anything, just let us know on the feedback as well, so we can address that in the next session as well.
Okay. So yeah, so wish you all a very happy Christmas and a very happy New Year as well, and hope you all clear your PLAB too. Have a great day. Goodbye.
Thank you.
Thank you.
Have a Merry Christmas and New Year. Isn't it?